Hello, I'm Dr. Lopez, and here at Olean Dental Studio, we get a lot of questions about periodontal disease. So today I'm going to take some time to answer some of those most common questions that we get about periodontal disease. One of the most common questions that we get is, what are the diseases associated with periodontitis? Well, there's a lot of research out there that shows the connection between the infection in your gums and some other areas of your body. But the most common ones is we've seen that there is a connection between periodontal disease and diabetes. There's also a connection with some heart disease. We have seen also some people with periodontal disease that also has Alzheimer. There was a recent study that shows that the bacteria, those that you find in the gums of people with gum and periodontal disease, is found on the brain of people with Alzheimer. So it's really important that we make sure that we clean everything so we can minimize that connection. Among others, we also have a connection between periodontal disease and some arthritis, some autoimmune disease, erectile dysfunction, and many more. Question that we get asked a lot here at Dental Studio is, what is the progression of the periodontal disease? Well, unfortunately, periodontal disease is a chronic disease. What that means is it's a disease that we don't really have a cure. And the progression of the disease depends a whole lot on a couple of things, like how aggressive is the bacteria in your mouth, but also what's your ability to control, to fight that bacteria. So sometimes someone who neglects their hygiene and who doesn't go to the dentist very often, they can find themselves with an aggressive periodontal disease that's actually moving really fast. Where someone who is actually taking care of the teeth and visiting their dentist, even though they're going to have a chronic disease, the progression of that disease is going to go really slow. What that means is more than likely that disease is going to be present, but it's not going to be causing a lot of problems. Another question that we get a lot is if genetics plays a role on the disease. And the short answer is yes. It's found that 1 in 3 Americans, in adult Americans, have periodontal disease. And it's very common. It's very common to see it in the families. Like if your parents or someone close to you has periodontal disease, it's very common to actually have the condition. Also, it's a disease that can be transmitted. So at the end of the day, it's an infection. So if your significant other also has periodontal disease, and you can just share all of that infection, and it's important that not only you take care of the disease for yourself, but you take care of the significant other. So both of you can be healthy. Question that we get asked a lot is how periodontal disease affect the heart health. Well, the most common thing that we find is endocarditis, and endocarditis is basically an infection on the heart. So people with periodontal disease, all of that bacterial infection go to the bloodstream and can travel to other places in your body, such as your heart. And if it gets there, it causes the endocarditis, which is basically a lethal condition that could potentially kill you. So it's something that we shouldn't take too light, and it's important that we address all of those periodontal diseases. A very important question that we get asked a lot here at Olean Dental Studio is, what step can a dentist make to treat periodontal disease? Well, the first step is to go visit your dentist on a regular basis, because number one step is to determine if you have the disease or not. We have to do some measurements on your gums. We have to take some x-rays. We have to do a clinical exam. We have to see if you have blood coming from the inside of your gums to determine whether you have the condition or not. Then, depending on the severity of the condition, we may need to do what's called a deep cleaning. The reason for the deep cleaning is because when you brush at home, you can only take care of cleaning above the gum line, but the bacteria can reach places inside of your gums that doesn't matter how hard you try to wash, you just cannot reach them, but the bacteria will. So you're going to need the help of a professional who can do the cleaning for you and get deep inside your gums to remove all of that bacteria. Not all the time is the condition is because people are neglecting or not taking care of their teeth. There's a lot of cases where this disease, this chronic disease, will just get into your gums and it will go away from you. And you're going to need to have someone who can help you. And that's what we do. Some of the steps that we can take are doing that deep cleaning for you, where we get to areas that you cannot reach and we get rid of all of that bacteria. Once the condition is more stable, then we need to see on a regular basis. We need to do what is called maintenance cleaning, right? We call that periodontal maintenance. And typically, we do that every 3 or every 4 months, again, depending on the condition of the disease. Another important question that we get asked a lot is, what can I do at home to take care of periodontitis? Well, the most important thing is to control what you can, which is what's going on above your gum line. So the number one weapon to fight this war is to take care of using an electric toothbrush, because those are powerful. Research actually shows that an electric toothbrush cleans your mouth 10 times better than the manual one. Can remove 10 times more bacteria, food, and all of that. The electric toothbrush is 10 times more efficient than the manual one. So it's highly encouraged that every patient use an electric toothbrush. Another really cool weapon that can be used is the water pick. And the reason for the water pick is because flossing is great, but sometimes it can be a little bit tricky. However, a water flosser will take care of cleaning in between your teeth easier. So you use a water pick and you get into a routine where you clean in between your teeth. Then you use your electric toothbrush, and you do that at least 2 or 3 times a day, and that will help you tremendously to keep your disease under control. Another question that we get asked a lot is, when should I schedule my next appointment? Okay, I have to say about that, I hope you schedule the appointment before you notice or somebody tells you that you have some bad breath, because one of the things with periodontal disease is all of that bacteria from the inside of your gums. It can create a lot of pus, a lot of infection, and it will smell really bad. So I hope that you can schedule that cleaning before it gets to that point. Another important thing to know is that your gums are not supposed to bleed. So if you're brushing your mouth and you notice some bleeding, that's not a good sign. That's a sign that your gums are swollen, they're puffy, they're red, and they're just not healthy. And you need a professional to look at that. So we'll be more than happy to take a look at it. Just give us a call. We're going to take a look at that, and let's make sure that, we take control over periodontal disease. Okay, so I hope I have answered most of the questions that we get about periodontal disease. I just want to say that if you're ready to move on and take action, here at Olean Dental will be more than happy to take care of you. Just give us a call at 941-629-3200. Again, that's 941-629-3200. And we'll be more than happy to take care of you and your families. Remember, this is contagious, so we want to take care of you and everybody else in your household. Thank you.